Borderline personality disorder, or BPD, is a psychiatric condition characterized by intense emotional instability, impulsive behavior, and unstable relationships. Those who have been diagnosed with BPD often find themselves trapped in patterns of emotional chaos, difficulty in maintaining relationships, and struggles with self-identity. However, many mental health professionals, as well as some critics of the diagnosis, argue that BPD is not a disorder in itself, but rather a misdiagnosis stemming from unhealed childhood wounds. These wounds, often the result of trauma or neglect, leave individuals with an array of emotional and behavioral difficulties. In reality, these individuals may not have a distinct mental disorder, but a combination of characteristics that emerge from a lack of emotional regulation, unhealthy relational patterns, and unresolved trauma. Instead of labeling these individuals as mentally ill or disordered, it is more accurate to understand them as people who have never developed the necessary tools to manage their emotions, set healthy boundaries, or navigate conflict in a constructive way. BPD is often diagnosed when a person exhibits a persistent pattern of emotional instability, difficulty maintaining relationships, chronic feelings of emptiness, impulsivity, and intense mood swings. People with BPD might experience an overwhelming fear of abandonment, engage in self-destructive behaviors, and have difficulty controlling their emotions, often leading to outbursts or volatile reactions. These symptoms are distressing both for the person experiencing them and for those around them, making it a difficult condition to live with and manage. However, BPD is frequently diagnosed based on these surface-level symptoms without taking into account the deeper underlying causes. While the behavior exhibited by someone with BPD is certainly troubling, it is not necessarily evidence of a permanent disorder. Many of the behaviors associated with BPD, such as emotional instability, fears of abandonment, and intense reactions to perceived rejection, can be understood as learned responses to early life experiences, particularly those involving neglect, emotional abuse, or trauma. The roots of what is often misdiagnosed as BPD lie in childhood experiences. A child who grows up in an environment lacking emotional safety, where their feelings are dismissed, invalidated, or neglected, may struggle to develop the skills necessary for emotional regulation and healthy interpersonal functioning. Trauma can take many forms: emotional neglect, physical abuse, sexual abuse, exposure to violence, or growing up in an unstable or unpredictable environment. All of these experiences create deep emotional wounds that are carried into adulthood. When a child experiences a lack of emotional validation and care, they are less likely to develop the emotional tools needed to process and cope with their feelings in a healthy way. As a result, they may experience overwhelming emotions that they are unable to understand or control. In adulthood, these emotional responses can manifest as the intense emotional instability and impulsivity that are hallmarks of BPD. However, these behaviors are not signs of a lifelong disorder, but rather symptoms of emotional wounds that have never been properly addressed. One of the core characteristics of individuals diagnosed with BPD is their difficulty in regulating emotions. They often experience emotions more intensely than others and may struggle to cope with feelings of anger, sadness, fear, or shame. This emotional intensity can be exhausting and lead to impulsive reactions such as lashing out, self-harming, or engaging in reckless behaviors. These emotional responses are often a result of having never been taught how to manage or regulate emotions in a healthy way during childhood. Children learn emotional regulation through consistent and compassionate caregiving. When a caregiver responds to a child's emotional needs with empathy, understanding, and appropriate boundaries, the child learns how to process and regulate their feelings. However, children who grow up in environments where their emotional needs are neglected or invalidated may never learn these essential skills. As a result, they may grow into adults who are overwhelmed by their emotions and struggle to manage them appropriately. Another key factor in the development of what is often called BPD is a lack of emotional safety. People with BPD tend to have unstable relationships marked by extreme fluctuations between idealization and devaluation of others. This pattern is often driven by a profound fear of abandonment, which is rooted in early childhood experiences of emotional neglect or inconsistent caregiving. When a child's emotional needs are not met, or when they experience abandonment or rejection by a caregiver, they internalize the belief that they are unworthy of love and care. This deep fear of abandonment often continues into adulthood, causing individuals to cling to relationships or push people away out of fear that they will be rejected or abandoned once again. These patterns of behavior are not evidence of a personality disorder, but are rather the result of childhood wounds that have not been healed. The fear of abandonment, the difficulty in maintaining stable relationships, and the intense emotional reactions are all rooted in a lack of emotional safety during the formative years. A third characteristic commonly associated with BPD is difficulty setting and maintaining healthy boundaries. People with BPD may struggle to establish limits with others, leading to unhealthy relational dynamics. This difficulty often arises from childhood experiences where boundaries were either not respected or were overly rigid. If a child grows up in an environment where they were not taught how to assert their needs, respect others' boundaries, or handle conflict in a healthy manner, they may develop maladaptive behaviors that interfere with their relationships in adulthood. Healthy relationships are built on mutual respect, clear communication, and appropriate boundaries. A person who has never learned these skills may find themselves either overly submissive or excessively controlling in relationships, struggling to navigate conflict without resorting to emotional extremes. The inability to set and maintain healthy boundaries is not a symptom of a mental disorder, but rather an outcome of early emotional neglect or trauma. Instead of diagnosing individuals with BPD and labeling them as having a mental disorder, it is more accurate to recognize that these individuals are dealing with the residual effects of childhood trauma. The behaviors and emotional responses associated with BPD are not indicative of an inherent disorder, but rather of unhealed wounds that need attention and healing. Therapy for those with BPD should focus on helping them develop the emotional regulation skills, boundary setting abilities, and healthy coping strategies that they missed out on in childhood. Psychotherapy, particularly dialectical behavior therapy, has been shown to be effective in helping people with BPD manage their emotions and build healthier relationships. However, it is essential to understand that these therapeutic interventions are not about fixing a disorder, but rather helping individuals heal from the trauma they experienced and equipping them with the tools to live healthier, more fulfilling lives. Borderline personality disorder is often misdiagnosed because it fails to take into account the deeper causes behind the behaviors and emotional responses exhibited by individuals. Instead of labeling someone as having a personality disorder, it is more helpful to recognize that they are dealing with the aftermath of childhood wounds that were never properly healed. These individuals do not inherently have a disorder, but are lacking the emotional tools necessary for self-regulation, healthy relationships, and conflict resolution. By reframing the diagnosis of BPD and focusing on trauma-informed care, we can better support these individuals in their journey toward healing and emotional health.